Awesome. So thank you so much for joining us for this September call. And it's really great to see everyone. I see some familiar faces. Other people are maybe joining for the first time. And it's really great to have everyone. So once again, this is a Pandemic Action and Women in Global Health call, looking at gender in pandemic preparedness and response working group. And really excited to be able to bring this and to co-host this with my co-chair for this call, who will be introducing themselves shortly. So welcome. It is a safe space. We invite everybody to participate, to share their reflections and their views. And we will shortly, do a quick run of the agenda, but wanted to invite Sumegha to introduce themselves.
Thank you, Rosemary. Welcome everyone once again to our September session. And this time we're working on climate and gender. So exciting. So topical. I am Sumegha Asthana and I'm representing Women in Global Health. Today I am a global health researcher. I work with Georgetown University, but gender has been a core of my work throughout. Welcome again. I look forward to today's discussion.
Awesome. So I am Rosemary Mburu. I work with WACI Health. I am based in Nairobi, Kenya, and I'm happy to co-chair this working group and this meeting in particular. And so I think we'll get started with just a quick overview of our last meeting. It's really is exciting to see us gather back together. And when we last met, that was the July call. We were really talking about our experiences, our preparation, our thinking, and our advocacy in the lead up to the high-level meeting on PPR. And members on the call had numerous reflections to share in terms of where the process was at that time, and also in terms of what the key engagement moments were and looked like. And so I think we are just now counting days to the time we get to the PPR high-level meeting. And it will be great to, I think, just see, even as we contribute to this conversation, focusing on gender, climate, and PPR, to also hear reflections about colleagues who might be going there or who are engaging and how that is looking like. So we continue to invite you to introduce yourself in the chat. Kindly also utilize the reactions. You can use the raise hand function, or you can unmute yourself to request to speak. As mentioned, we are recording this call for purposes of reference. And so in terms of the agenda, I think going forward, as we have mentioned, it's really looking at gender, climate, and health / pandemic PPR. So this is really critical and important because there has been a lot of conversation coming out of the Africa Climate Summit. I don't know how many people were able to participate and to be in Nairobi, but the Africa Climate Summit just winded up last week here in Nairobi. One of the key reflections that I can bring or I can share here is how, even though Nairobi was very busy with people from all walks of lives, and many African heads of state actually also participated. So there was a really good delegation, head of state. But the conversation around health, the conversation around pandemic, was more like a sidelines conversation. So I think the biggest take home is that we still do not have, within the climate conversation, we haven't really explored the nexus, between health and climate in terms of bringing that into such conversations. I would say if you look at the Nairobi Declaration from the Climate Summit, health is probably a footnote. It's almost not mentioned. And even within the space where the Africa Climate was happening, which is the Kenya the Kenyatta International Conference Center in Nairobi, it was a lot of energy conversations, e-agriculture conversations, conversations about pollution, which are all important conversations. I think the reflection here is to say, as a working group that is interested and sees the intersection between climate and health, between pandemic and climate and all that, there's a whole lot of work to do. And I will not be the person speaking about this. Mine was just to give a quick reflection from Nairobi to say we still have a long way to go, especially if we want to shift conversations at COP28. But today we do have speakers lined up for us. We have Ayan Harare and we have Catarina. And I will not attempt to pronounce the full name. I will invite them to introduce themselves when your turn comes, just to make sure that I'm also fair to the pronunciation. And so without further ado, I want to introduce you to Catarina. So Anna, as I introduce yourself, I'll request you to unmute and to come forward. Anna is a clinical lecturer in public health medicine at the Institute of Health Informatics at UCL and specialty registrar in London. She is also honorary lecturer at KCL. You will tell us the acronyms, sorry, when you come on board, and the George Institute for Global Health at ICL. And she completed medical school in Portugal in 2012 and moved to the UK, inspired by her dream of working for the NHS. Although she initially started her specialty training in cardiothoracic surgery in Manchester, her long-term illness forced a sharp turn in her career. She completed her doctor in philosophy in women and reproductive health in the University of Oxford, simultaneously with an MSc in public health at KCL. So Catarina, I want to welcome you and invite you to share your reflections and also to maybe introduce you perhaps better than I did, but you have the floor in terms of taking us forward and reflecting with us, around an overview of your work related to this topic and any relevant background for the audience on the intersection of gender, climate, and health. Over to you.
Thank you very much. Thank you very much for the kind introduction and for inviting me to present today. So my name is Kat, as you said, and nobody calls me Anna, so my name is Kat. And I'm a public health doctor in London, and I work in a lot of different universities, and I've been doing lots of work to lots of research and advocacy on gender inequalities, both in academia and also in society broadly. And because my main interest in terms of work and research is on environment and climate, now both things intersect, and this is a priority for me, is to really look at the climate crisis from a gender lens, because all crises have a gendered impact, as the COVID-19 pandemic showed us. And unless those gender dimensions are considered, what will happen is that the gender inequalities will just exacerbate, as we saw during the pandemic. And we are still dealing with its aftermath, and the consequences will be felt for a long time. Can I share my screen, please?
Yes, Kat, I'm going to give you screen sharing permissions right now. Hold, please.
Thank you.
You should be able to share now. Let me know.
Yeah.
Perfect.
Can you please confirm that you can see my slides?
Yes.
Yes, looks great.
So just because I'm not an expert in pandemic preparedness necessarily, I'll just give you mainly the key points on gender and climate change, and then make the case for why climate is increasing the risk of pandemics, and the two things may interact synergistically to exacerbate their consequences on women particularly. And we know the climate crisis is not gender neutral. Women and girls experience the greatest impact of climate change, which amplifies existing gender inequalities and poses unique threats to their livelihood, their health, and their safety.
Kat, sorry for interrupting. Would you like
Yep.
to, yeah, can you do full screen for your slides? We see 3-4 windows here.
Is it not in full screen?
No,
No,
Is my
it's not.
screen not?
you can do the
No?
slideshow.
Is it not showing in slideshow?
No. So we see the no. Yeah, thank you.
Please wait. This way you can see it. Yeah. And the consequences of the gender inequalities are manifold, or the reasons for the gender impact of climate change are manifold. On one hand, we know that climate change is going to exacerbate the risk of migration and displacement because people lose their jobs because of extreme weather events and disasters, as we have been seeing, particularly these past year. And women are the most likely to have to migrate and be displaced. And in those circumstances, they are exposed to many threats such as violence and sexual exploitation. Climate change also increases the risk of conflicts, including armed conflicts and violence. And we know that in those settings, the risk of, again, violence and sexual exploitation, particularly for women, are increased. Agriculture is another key sector that is impacted by climate change because of disruption in weather patterns, and women constitute most of the agricultural workers, and many women in low-income countries rely on subsistence agriculture. It is extremely vulnerable to these extreme weather events and changes in climate. And we have seen floods, we have seen heat waves, lots of disasters. And in those circumstances, women have less ability to cope because of societal gender inequalities, but also because of biological differences that make them more vulnerable to the harmful consequences of heat. And we know, as we saw during the COVID-19 pandemic, that some of the services, the healthcare services, first to be affected during times of crises and disasters, conflicts, are maternal and child health services, And if those things are compromised, their reproductive rights cannot be ensured, and we see increases in avoidable maternal deaths and early childhood deaths. And to compound the problem, women's voices are rarely heard, and they are not represented proportionally in the discussions about climate change. This is the picture from COP27, the immediate past COP, and the question is, where are the women really? It's a delegation of men. And this is really concerning because, well, women should be 50% of the people there, right? And if they are the most impacted and their voices are not being heard, that means that their perspectives are not being taken into account on one hand. And on the other hand, the research that has been done shows that when there is gender diversity in the discussion tables, the decisions that are made are better, not just for women, but also for men. And that's why it's really important to promote gender equality. And this is a slide that shows you women's participation in country delegations. There was an increase up to the peak was in 2018, where it reached almost 40%, but it was just about 35% in the previous COP, maybe a bit less than that. I think it was like 33%, which means like 1 in 3. And some delegations had basically no women at all. So women's influence is low, when the impact of women is very high, and it's this imbalance, this unfairness that we strive to address and advocate for. And this is a slide that shows you when the proportion of women in parliament increases, the decisions that are made are more likely to be climate beneficial. And that's what that index, CLIMI, means. And this is something that is not published yet, and this is research done by me, that using an index called the Notre Dame Global Adaptation Index shows that the greatest the gender inequality, the least adapted the country is. So the countries that are more gender unequal are on one hand more vulnerable to the impact of climate change, because this index combines both vulnerability and readiness, and are less ready to respond to the risks posed by climate change. So it's really important, and here we use 2 different indices to measure global gender inequality. One is the Global Gender Gap Index from the World Bank, and the other one is the UN Gender Inequality Index. That's why, because one measures equality and the other one measures inequality, that you see that the association goes in opposite directions. But it's really conspicuous. And of course, it's also obvious that the countries with the least adapted countries are the countries in the global south, and those are also the countries with the greatest gender inequalities. And so what does this mean for us? And we have the COP28 in the UAE approaching fast, and these are the words of Dr. Sultan Al Jaber. We want COP28 to be a COP of action, a COP of impact, a COP for all. But there is no way to achieve any of this vision without putting gender equality front and center. The question is, are we going to achieve that? And if yes, how? Well, at least there is gender equality in the schedule. That's a good start. It would be even worse if it was not being considered, but it is considered in a day packed with lots of other things, because 2 weeks is clearly far too short to discuss everything. And this is what the schedule says, that Gender Equality Day will focus on how gender responsive policy making and better access to finance are central to achieving a gender just transition that advances gender equality and allows for the full and meaningful participation of women and girls in climate action. So on one hand is the gender just transition, so something that needs to promote gender equality and our transition to a greener mode of living that is well beyond the economy, but also combines these with fair participation of women and girls in climate action. And these are areas that have been identified, or 4 key areas that have been identified as priorities for the COP. And one is ensure that the loss and damage fund is gender sensitive and a transformative platform for inclusive and just climate action. And as I said in the beginning, women are the worst impacted by disasters, violence, migration, agriculture. And so it's really important that when the loss and damage fund is administered, and we hope that at COP28 there will be making progress with decisions on how to actually deploy it, that gender equality and the health and well-being of women is prioritized. Increase and enable women's access to inclusive climate finance. There has been increasingly call for the high-income countries to provide the funds that are necessary to low-income countries so that they can really transition to a greener economy, or actually ensure that they develop in a way that is sustainable. And that means that some of that finance needs to be given to women because they are key players in local economies. Promote women's parity at COP. That means that both the delegations and centrally, their voices need to be heard, and it's not in a tokenistic way that we want this to be achieved. They really need to be, the process needs to be really fair and meaningful, because they need to have a voice, their decisions need to be considered. And lastly, strengthen the integration of gender in UNFCCC processes and climate change policies. So it's to ensure that gender is in all policies, gender is always considered, because if these things are overlooked, the gender dimension is overlooked, then women will suffer even more, women and girls. And the only way to avoid it is to put it front and center and think about it before the consequences are felt and then it's too late. And this is my last picture, is climate justice equals gender justice. And until this is achieved, understood, and enacted, women and girls will remain disadvantaged. So thank you very much.
Thank you so much, Kat, for that presentation, highlighting really, really important points and concepts for us, and really asserting the need to ensure that even as we engage in the climate justice conversations, we are not forgetting what that looks like from a gender transformative point of view, gender sensitive, gender inclusive. And like, I think one thing that stood out for me is when you say that countries, the more a country is less gender equal, the more likely it is for it to experience the impact of climate crisis. I think that's really powerful, and I think that's a message definitely to take to our leaders. You pointed out, this, ensuring that the loss and damage fund, for example, is gender sensitive and a gender transformative platform. I think those are really critical things to call out for, even as we continue to engage in this space. And then, like, really important, making sure that when we talk about climate financing, it's inclusive. We are thinking about those platforms as platforms that are inclusive, and where we are thinking about gender even as we set them up, and we look at how we operationalize whatever funds, platforms, mechanisms come up out of these conversations. So we will have a Q&A later. I'll first of all hand over to Sumegha to introduce our next speaker, and then we will have the discussions all together. Continue to chat us on the chat, introduce yourself and ask questions there as well. Sumegha?
Thank you, Rosemary, and thank you, Kat. That was a really insightful and a powerful presentation. My takeaway is that nothing will happen till we have funds attached to it. So that's one key action point for all of us in the room today. I'll take this opportunity to introduce Ayan Harare, who is a global health expert and senior technical advisor to Somalia government with a focus on health and climate change. Welcome, Ayan. It's an honor to have you here today. She has a wealth of experience gained from working in various organizations, including Concern Worldwide and the Danish Refugee Council. She's managed and provided strategic advice on numerous humanitarian and development projects in Somalia and Kenya, with particular emphasis on social protection, health and nutrition, and climate change adaptation. Ayan holds a master's degree in global public health and nutrition from University of Westminster in London, as well as a degree in biological sciences from the same university. Her interests revolve around intersection of climate change, health and gender, climate justice advocacy, and adaptation measures to mitigate the risk of climate change. Ayan, we would like you to talk first. If I miss something, please introduce in your wealth of experience and knowledge, and give us an overview of your work related to the topic at hand. Any relevant background you think for the audience in the intersection of gender, climate change, pandemic preparedness at stake in the COP28, particular focus on women at the front lines. And also, please share your experience as a youth delegate at COP27. Was gender perspective present there? How can it be integrated this year? Over to you, Ayan.
Thank you so much, Sumegha. Thank you, Rosemary. I hope you hear me well first. Thank you so much. So I'm deeply honored to be here with you today and to discuss my experiences on the intersections of climate change, health, and gender. So my sister Sumegha has actually mentioned all about me. I'm Ayan Harare, Women in Global Health Somalia chapter. I'm also an advisor to the Somali Government Minister of Health, and at the same time, I contribute to the Office of the Prime Minister on the capacities related to climate change, food security, and health. So I had the privilege to attend quite a number of climate change conferences, including the COPs and Africa Climate Weeks, both regional and globally. So my experiences today will focus more on the Somalia context. That's where my experience. I want to thank my sister Kat for mentioning going through the global perspectives of gender and climate. But I will be more specific today on the Somalia, how Somali women have been impacted on climate, how is the situation on healthcare workers in Somalia. So Somalia, despite its minimal contribution to the global greenhouse emissions, the country faces significant challenges arising from climate change. Since 1990, the country has witnessed 30 climate-related crises, including 12 droughts and 18 floods. And it's actually unfortunate that the country is in between flood or droughts. The climatic results has also caused displacement, loss of livelihoods, loss of livestock, loss of agricultural productivity, food scarcity, malnutrition, disease outbreaks, with women being the majority of the affected population, constituting 80% of those displaced by climate-induced events. At the end of 2022, Somalia has faced the worst drought in 40 years, and displacement has reached a record high of 3.9 million, with over 1 million only displaced in 2022 as a result of 5 consecutive failed rainy seasons. Currently, more than 10% of the Somali population are displaced, while half of the population, like 7 million Somali people, are food insecure. In terms of Somali women, they have played, as you know, Somalia has been in civil war for a very long time. So women have played crucial role in peace building efforts in the country. They often served as primary breadwinners for their families. They have women in the diaspora have been instrumental in supporting their families back home, providing them with education and opportunities. Despite that contribution, Somali women, according to the World Bank, Somalia is ranked the 4th most gender unequal country globally. So 56% of Somali women cannot read, and they stress in parts that 36% of them get married before the age of 18. The dire situation in maternal and child health also is staggering, like 692 out of every 100,000 women lose their lives while giving birth. So it's also very crucial to understand when each catastrophic event occurs, such as the pandemics like COVID-19 or natural disasters or conflicts, these risks actually exacerbate gender disparities in access to healthcare, in access to education, access to job opportunities, or participation in public lives. So the glaring issue, even within the government, is that representation of women at the parliament is mere like 24%. There's a very shortage of women ministerial roles in the country. The healthcare sector, similar to the global, more than 70% of health services are delivered by Somali women. But then when you go to the leadership, even at the hospital management side or Ministry of Health directors or sector heads, like their leadership roles is less than, I would say, 15% or 10%. We don't have the exact evidence data, but it's very, very low. If we discuss about how climate has had an impact on gender and health in Somalia during the droughts, there's a long-standing household tradition in the country that women are the last to eat or skip meals, respecting their sons or their husbands. This puts women and girls, especially pregnant and nursing women, at risk of malnutrition. And additionally, the responsibility of fetching water is a task that's primarily assigned to women and girls, forcing women to travel for a very long distances in search of water, which again puts them at risk of gender-based violence and vulnerable to potential violence. According to the UN, climate-induced disasters are also often linked to rise in instances of sexual violence, intimate partner violence, FGM, affecting children, adolescent girls, and women. During the crisis, also the hospitals become overcrowded with mothers and families in need of not just health services, but also in need of food assistance sometimes. It's truly disheartening when you witness some of the hospitals during the droughts or floods. You will witness mothers who have traveled very long distances with 1 or 2 malnourished children and have left the others at home with no food. So nurses, who are primarily women, endure the most of this burden. So they work tirelessly, often without insurance or without adequate protection and any form incentives, with even meager wages for their dedication. So my experiences on attending climate conferences, despite these challenges that I have faced, I had the privilege to attend the last COP27, and I always go to the regional and global climate discussions, trying to get the stories from Somali women into these platforms. However, my observations have seen like there's inadequate address of the dire impact of indigenous women healthcare health professionals in both roles of adaptation and mitigations. So as my sister Rosemary mentioned, like health is always left out in the climate discussions. What comes first is more on agriculture and water. Gender has been discussed, but the real women, the indigenous women who actually have impacted heavily by this crisis, you never see them in such conferences. The COP27, it's worth to mention that it has concluded review of gender action plans and implementation, and it has included amendments to be made to the existing goals and to introduce new activities in priority areas. But this all seems like just talks with no implementation at country level or national levels. Again, women representation at the negotiation tables is very, very low. What you see in such conferences is dominated by high-level representation from corporates, these big companies and government bodies, and often excluding indigenous communities. So most affected by climate change are often unheard, while corporate interests and polluters continue to exert influence and shape the conference outcomes in ways that favor their businesses and interests. So last week, I also had the privilege to attend the Africa Climate Summit, where all African women and African civil society organization countries had a lot of hopes on their position on the COP28. But then it's actually disheartening to say that the declaration that came out was a gender and health blind, as Rosemary mentioned earlier. At country level and regional levels, policies and strategies related to climate change often lack inputs from communities. There's a notable absence of women of healthcare workers in our strategies like the NDCs or national adaptation plans. It's also noteworthy that COP28 has dedicated a day for health discussions. That's something I'm looking forward to, but I'm not sure, and I call everybody who is in this call today to keep an eye on the COP28 Health Day and to ensure if there's any way that you can attend this conference to take the stories of health workers, the effect of climate change on maternal and child health, and the essential inclusion of women voices. So I know I have mentioned I've been radical about gender and climate and health, and we mentioned so many challenges, but my opinion on how we can change such things, what needs to be done on the ground, addressing gender issues is essential in addressing climate and health challenges. To do so, we must implement systematic approaches at national level and prioritize locally driven interventions. Even if the COP presidents agree to do something about the climate change, we cannot change anything if our systems are blind on gender issues and health issues. So women and women-led civil society organizations play a central role in driving change for both grassroots and at the top. To transform the states of women fundamentally, we must start by initiating change within national legal systems, within the national policies, within the national strategies. And we can do that by supporting local women and training them in leadership skills, raising their awareness of their rights, encouraging them in participation and to take their seats, not to be guests on what needs to be done. And although not always upheld, thanks to the continuous pressure from the Somali international community, there's a 30% quota for Somali women to participate at parliament. Such affirmative actions are really needed in critical sectors, including the health leadership. We need to ensure that 30% quota are actually implemented at the health care leadership and all other policy making circles. Currently, the progress of women's rights relies heavily on international NGOs, the UN, mainly through short-term community-led initiatives that sometimes overlook the fundamental legal rights. International NGOs are maybe cautious about appearing to impose foreign policies and often avoid intervening in the national laws and national regulations and national policies, but quite heavy amount of money has been spent on these short-term humanitarian interventions, which that money could have been used to empower local women to challenge the existing systems and the government and to educate them on advocacy for their rights. Achieving systematic changes, although time-consuming, it's a vital for sustainable progress, similar to any other developing countries. I have studied in the UK and lived most of my life in the UK, and I'm sure UK is not the same as it was in 50 years ago. So this takes time, but comes up with the sustainable solutions. I encourage in conclusion, the gender disparities in Somalia are deeply concerning and multifaceted. The limited representation in the government, disparities in healthcare leadership, and persistent gender gaps exacerbated by climate disasters all demand our attention, concerted efforts to bring about positive change. So I encourage everybody who is in this call to stand in solidarity with Somali women as they advocate for their legal rights, for their participation and decision-making tables. Ultimately, I believe we are all united by our community identity as women. The global climate crisis underscores the interconnectivity. What happens in Somalia affects the US, and the developments happening in the US impacts the lives of the innocent rural women in Somalia. So it's really imperative that we all stand together and address the climate change challenges collectively, placing women at the front of our efforts. Thank you so much for the time again, and over to you, Sumegha.
Yeah, I'll take over and she's going to come a little in a few. So thank you so much, Ayan, for sharing with us the reflections from Somalia. Really a strong case study on why this is important, looking at the intersection of climate and health, or if on pandemics, if you may. So we are running a bit late. I want to see if we have questions. We are in the Q&A discussion. We don't have as much time as we would love, but even about 10 minutes or less of reflections, comments, what stood out for you. Colleagues, you can use the raise hand button, or you can unmute and just come on and reflect or make your comment. So as you do that, I take note of the comment by Tala. Tala, this is exactly what I was thinking when Ayan was presenting. I was thinking about local capacity. I was thinking about local expertise. And you actually also outlined that, in the chat, saying that these are some of the excuses that funders will give to say that there is no local capacity, there is no it's not sufficient, we need to train, and there's all that, which is part of why we also need to advance this decolonization kind of conversation within global health, within all these different things we are talking about. So that point is very well taken. I see we have Lizzie and Alison. Please, Lizzie and then Alison.
Sure, thanks, Rosemary. Just a quick one. I mean, clearly during the Africa Climate Summit, health was not an issue for discussion, so to speak, because it ended up being a preamble on the Nairobi Declaration. I mean, and I know we're talking about capacitating, and we saw even comments by local members of parliament who did not even understand what climate change is. So what would be the next step in trying to get people to understand what climate change is and why we're trying to say climate change and health should be discussions that, go hand in hand. So I think I would like to direct that to any of the speakers who actually gave comments earlier on. Thank you, Rosemary.
Thank you. Alison?
Thank you so much. I had a question for Kat related to, the data that was shown around, the least adapted countries being also the most unequal. And if we sort of have an understanding of, why that is the case, and what are, how might we lean in more? What are the sort of facilitating factors to help those, countries that are both less equal and also least adapted? If we can understand better, where do we lean in? What are the facilitating factors to help address gender inequalities and to help with preparedness and adaptation? It would just be great to have some insights.
All right. So we have Lizzie, another Lizzie.
Hello, everyone. Good afternoon, good morning from wherever you are. My question is, are we really working on climate as it affects or impacts on health in our communities? And how do we begin to build the capacities of even we, the advocates, so that we can step it down to the communities where we work? I think it's vital in making it to become a household issue. This is my question. Thank you.
Thank you so much. So we have those three, and I'll turn to Kat or Ayan or other colleagues who might want to reflect on any of those. Maybe we start with you, Kat.
I'm not sure I understood the first question from Lizzie. I don't know if she wants to explain it a bit better. And I understood she referred to the two charts that show the graphs that show the adaptation and gender inequality. And I don't know if what she was asking is why that could be.
Yeah, so the question from Lizzie was about how do we get like policymakers and decision makers on board. I think given from the experience we saw at the climate summit in Nairobi, where you have policymakers, decision makers really being so green about the climate crisis and coming from an ignorant point in terms of what is happening around us. How do we get political will if the decision makers and the policy makers actually are blind to this? And then I think the other one was around whether are we really looking using a health lens or even a climate lens when we engage in our health work, advocacy, policy making, etc., etc.
Yes, I think that it is critical to show to policymakers that unless women are fairly and proportionately represented at the table where decisions are being made, the decisions are unlikely to really reflect the perspectives of the entire population on one hand, because half of the population are women, and it's unlikely that they are going to be the best decision. So basically, if countries are not including women in their climate action, that means they are sort of depriving themselves from half of their workforce. And that then leads to worse adaptation and also mitigation. And we show it for adaptation because there is a well-recognized, well-established index, but it could be shown for mitigation as well, because women, particularly at local levels in the global south, and that brings us back to the question that was raised by the second Lizzie, is they are really key players at local level in their communities, and they have a powerful influence, and their ability to really create momentum and engage communities is something that cannot be overlooked and tends to be overlooked by policymakers. But they are very disadvantaged. There is a lot of gender inequality. They are not given their ability, for instance, in terms of education, we know that empowering women relies on education, and because of what happened during COVID, many girls were taken out of school and didn't really go back to school afterwards. So there is a generation that is going to be less able to advocate for themselves, less able to take action because they were not given the education they deserved. And we also have seen what has been happening in Afghanistan, where women are not really being allowed to get access to education, and that's going to be harmful for that country in the end. It's just how do we show that? And there is no dearth of evidence. What is lacking is really action by those in positions of power. And sadly, those are mainly men, and they perpetuate this kind of men's club where they have their own, it's in their interest to keep women out of the negotiations.
Absolutely. Thank you so much for reflecting on that. And the photo you showed us on the slide, of COP27, all male and all the manels that happen is a testimony in terms of who actually is making the decisions. Thank you so much for that. Ayan?
Yeah, I'm just going to add a point on the how do we convince the decision makers? How do we engage with them, and how do we show them that to ensure gender and healthcare workers are at the center of everything? So one thing we need to know is that these people in power will not call you and invite you for discussions, but it's us who need to, as women, to go and take our seats, not to be guests at all. And that comes, as Kat mentioned, through education, through empowering, through a lot of advocacy and influencing and raising the awareness of the people, of the women. I always tell my the friends, like female, in Somalia, to take the seats and never wait to be called. No decision maker person will call you and consult what's happening, but it's your rights, it's your own rights. You need to force this participation. You need to find them, whatever it takes, and you need to be part of the systems and try as much as it's very difficult. Rosemary, as being Africans, it's sometimes very challenging. But if we don't do that, then we are not expecting anything. Thank you so much.
Thank you so much. I know we have so many other comments in the chat. We appreciate all those. And we're also conscious that we are running out of time. So in view of that, and as I turn to hand over to Sumegha, I think my two reflections from me. One is that based on the conversation here from the two presenters, the input and the comments that are coming here in chat, one of the things to be conscious about is that when we talk about gender inequalities, these are man-made. I mean, these are not occurring in the nature. They are not naturally occurring. They are man-made. So it's going to take people to dismantle them. And so I think we will need to then position our conversation in this narrative within a structural, historical, and even cultural context, as Ayan, you are saying, and just look at what is it that then continues to serve as a barrier for us as we talk about ensuring that the gender-centeredness of the conversations within climate, within pandemic, we really have to think about how do we deconstruct what has been constructed over years and years, about gender. And also, I think the other thing is that how do we make sure that at the decision-making level, like Ayan, you were saying, look at in parliament, in our parliaments, in most of our countries, in parliament, those decisions are being made by men and really being ignorant about gender dynamics and all that. And the last thing is that even as we have these conversations, what I'm picking is that we will then need to think about resilience, whether it's resilience in climate, resilience in pandemics, also about prevention. How does that look like? What kind of financing is important? And also thinking about response, both for climate and for pandemics, if you may, in terms of, what are some of the mechanisms that are existing, around financing, while conscious that financing is not the only thing that is going to get us to what we want in terms of winning from a gender perspective. So, Sumegha, I hand over to you to take us through the rest and to close us.
Thank you, Rosemary, and thank you, speakers, for this really insightful discussion today. Before I go to the closing, I would just open the floor to anyone who wants to share any updates around new research, upcoming events, or advocacy opportunities with the wider group in the space. You can also share these thoughts in the chat. But is there any event or research that you would want to talk about and share with the wider group? Please feel free to use the chat to that. I'll just take 2 minutes to sum up what we discussed today. Just going over the levels of exclusion, health is left out in the climate discussion. Women, especially the indigenous women, are further excluded from the discussions. This is again then being resolved by tokenism and rhetorics, and it's not going to help. So exclusion of those who are impacted, and then inclusion of those with commercial and private interest just speaks volumes about what is fundamentally wrong with the way we are governing things and how things are moving. The solutions that we discussed started around prioritizing local interventions, strengthening national systems and women from the local contexts, giving them more space in the national systems and strategies. Someone also talked about we should be strengthening the local systems and training them to avoid reliance on the donors and train them in fundraisings. We also had discussions around how do we engage the decision makers to be more open to give space. But as one of the speakers also highlighted, I would want to stress again on the urgent need for women to ask for their rights. Maybe not ask, but snatch their rights for participation and for speaking in the avenues where the decisions impact them. And I would just close with that, telling you a bit about the next steps around the notes that will be shared by email, and also about our next working group meeting, which will take place on 14th November 2023. Someone shared the Pandemic Action Network and Partners for Building Back Better. That's in the chat for you to say from the Pandemic Action Network group. And there's a registration link as well. Thank you all for joining today, and we look forward to seeing you again in the November session. Any last comments from anyone? Any reflections are welcome. Over to you, Rosemary.
All right, so I think we've been given the way forward, the next steps, when we have the next meeting, and that the notes will be shared. We want to thank you so much for participating and for continuing to engage and really bringing the conversation of how we center gender on all these conversations within the global health space, and now within the climate crisis space is very important. We wish you a wonderful day further. Thank you so much. And thank you, PAN and Women in Global Health, for hosting us.
Thank you, everyone.
Thank you, everyone.